Hello, my name is Isabella Decker, and this is my Nursing Capstone presentation on nursing risk assessment and early intervention of postpartum hemorrhage in mothers. I had the pleasure of doing my senior preceptorship at St. Joseph Medical Center on a labor and delivery unit. My interest in postpartum hemorrhage management began after a family member experienced a postpartum hemorrhage event following a home birth, and also after seeing the dedication to quality preventative measures used by the nurses on the labor and delivery unit at St. Joe's. When exploring the literature, something surprising to me was that there was a debate on which medication should be used as first-line interventions for postpartum hemorrhage. There was some debate on whether or not misoprostol or cytotec is equivalent to the use of oxytocin or pitocin as a first-line intervention. There was also some debate on whether or not tranexamic acid should be used as an adjunct therapy in addition to first-line medications or could be used as an intervention medication alone. This was particularly interesting to contrast the use of oxytocin as a first-line intervention at St. Joe's and weighing the pros and cons of each, as well as the side effects to see which one would be best for each patient. Something else that surprised me with the literature was seeing the difference in the amount of research coming from the US versus European countries. There weren't many studies done recently, and the quality of research done by Europe was much better than the research coming from the US in recent years. Some key takeaway points from my presentation would be that the most common causes of postpartum hemorrhage have to do with uterine tone, tissue retention, trauma to the vaginal canal or uterus, and coagulation issues. Additionally, another key point would be that assessment, including risk assessment, evaluation of blood loss, evaluation of uterine tone, as well as evaluation of changes for vital signs, is important and some of the key pillars for early identification and early intervention for postpartum hemorrhage. The last takeaway from my presentation would be the importance of continued monitoring for patients who are at high risk for postpartum hemorrhage or have recently experienced a postpartum hemorrhage event. Postpartum hemorrhage can cause significant sequelae if not handled properly, so it's important to monitor the status of patients even after they've received intervention. It's also important to understand when you should activate the postpartum hemorrhage protocol and what part of the team you should notify first. Open communication with the OB team as well as the postpartum staff is important in maintaining patient safety when it comes to postpartum hemorrhage. A question posed by one of my colleagues was whether or not I believe that the high maternal mortality rate in the US was linked to the increasing number of women in labor that we see with chronic illnesses such as diabetes, hypertension, and cardiac issues. While I didn't see much answers in literature, from my perspective, I do believe that because the US is seeing significant increase in secondary health conditions or chronic health conditions, it's not surprising to see the increase in women who are in labor or pregnant with these secondary or chronic health conditions. And yes, this may contribute to the increased rise in maternal mortality rates as the secondary conditions or chronic health conditions such as obesity do increase the risk for postpartum hemorrhage. I want to acknowledge my fantastic preceptorship team at St. Joseph Medical Center for providing a knowledge base for this presentation and rooting me on. I also want to thank my family for being supportive during these changes caused by COVID-19. And a big thank you and shout out to all my nursing friends and support group. You guys are fantastic. You guys have the best support out there, and I couldn't thank you enough for rooting me on. Go Lutes! Thank you so much for watching.